Hello everyone, it's Matthew McKenzie here. I promote lots of videos and blogs basically on unpaid carers, mental health, equality, and supporting those who are living with long-term ill health, whether it's mental illness or cancer. Sometimes I extend beyond that, but most of the parts, especially from either my blogs or videos, it's usually on families and unpaid carers. But with my anti-racism and equality hat on today, I'm presenting a focus on how racism affects Black and minority communities and why mental health services must actually help lead that change. And it's not really leading, to be honest. I think everyone can play their part. With this video, it's probably going to go on for a few bit. I'm going to try and skip over some things, though, just to speed a few things up. Before I continue, a bit of shameless advertising. If you're watching off my YouTube channel, do feel free to subscribe. As mentioned, if you do enjoy the topic, there'll always be more content regarding unpaid carers. That's most of the videos I promote on, whether it's mental health inequalities or qualities. So we're looking at basically racism. It doesn't exist in this solo form. It has an impact, especially if you're outside in that community. In fact, it's everywhere, to be honest, especially in this current climate as of 2025 in the UK and beyond, obviously. But I'm going to focus on the UK as where I'm from. We want to look at the impact of racism in the community. Now, racism actually does exist. We all know it does. We've got to come clean on that. But it does, because of its existence, it does continue also to affect Black and minority ethnic people. Not only just Black, Asian, Indian, traveling community, LGBTQ plus, through discrimination and exclusion. I will explain these in a fair bit of detail in a bit. But I just want to start with this particular premise. It also has inequalities in education, employment, housing, and policing. But before I do continue, let's say, all right, we have an impact, and we're going to look into that impact in a bit. What exactly is racism? What is this form of discrimination when it's targeted at ethnic minority and those in the community? Well, we've got one of the most difficult forms of racism, can be hidden until you see its outcome. And it's usually, well, it's institutional racism. And you can see its outcome on unequal treatment, not just in health, but also in education. If there's, when it comes to data, always shown to be groups of minority peoples who are often struggling with health or struggling with education or struggling with the criminal justice system, then there's some link somewhere to racism. It also leads to high rates of exclusion, detention, whether it's especially in the criminal justice system, especially if those ignore poverty and seek to blame this on race alone. And if you're going for mental health or health, then it's misdiagnosis amongst Black and minority people, especially if it's not culturally sensitive or appropriate. Other forms of racism, and I'll go through, I think, 5 more. We've also got workplace discrimination. Again, if data does come to show that there are barriers to promotion, there always seems to be not just Black, can be, as I said, Asian, Indian, other minority groups not getting those promotion, always kept where there is no opportunities. And racial bias in recruitment, unequal pay is another one, or not even recognizing the importance minority groups play in the workplace. You also got the healthcare inequalities. This actually is perhaps the key focus for this particular presentation. A lot of my focus is on mental health and healthcare. So I tend to focus a lot of my videos on this, and this is no different here. But I'm just explaining a bit more about racism, just in case, and there's no shame if no one doesn't know what it is. Ideas to help educate as well. So healthcare inequalities, this is where Black and minority patients often face delays in accessing healthcare. I've explained this a bit before. There can be a lack of cultural understanding. Hence, when I mentioned the issues of misdiagnosis or experiences of being dismissed by professionals, especially if, and this one is quite controversial, young Black men who often face stigmatization with mental health do decide to approach a health professional often and may end up being dismissed because of it due to maybe misunderstandings or difficulty in communication and language. Continuing on, also got hate crimes and online abuse. Again, these things are now quite prevalent in this day and age where we have a lot of online social media communications. And with that, you get a focus of misinformation, which can be directed at minority groups. This can lead to increased racial harassment. How this may happen, one might sort of ask, is it's easiest, for the most part, to actually hide online and send out messages or social media posts to racially harass groups or specific individuals because of their background. Now, I've mentioned, especially through social media, we've got I'll name one of the bigger ones, Twitter or X, as is now known, which actually has, as of now, 2025, increased with the issues of hate crimes and online abuse under the mask, I would say, of freedom of expression, which I would say sort of is a very dubious way to explain, a way to use the point of racism and hate crimes and online abuse. And this can actually now increase into the public spaces, especially schools. I won't really cover this in this particular video, but it does filter down if not monitored and not actually tackled. And this can lead to creating fear and distress, not just for minority communities, but for all those communities as people within those communities begin to distrust each other and distrust institutions. Also got the media. It's not just online, but the media and cultural stereotyping can, and in the past, have also been platforms of racism, hence misrepresentation or underrepresentation of minority groups in the media that reinforces negative narratives and public bias of minority groups. As we speak, there's a discussion, whether it's online, that too many Asian and Black people were in adverts. That might be the case in some sense of data, but that doesn't dismiss the impact of that others can hijack that and use that to create forms of racism. So I'm not excusing what someone said about this particular thing, but it's definitely a racist statement, and not taken into the context of the importance of diversity and what people can contribute to communities and more overall. We've also got environmental and economic racism. I'll give you a good example of environmental racism. We have an issue of poor housing. So I think I've forgotten her name, young Black girl who fortunately died to inhaling some sort of mold. And this is not uncommon when it comes to minority communities who unfortunately find themselves in poor housing, pollution, and cost of living pressures due to systematic inequality. So this is quite a clever one, quite a sneaky one, because again, you will have those who discriminate saying, look, we have Black and minority ethnic communities always in poor circumstances. So therefore, it must be their race. But basically, it's a circular argument. Behind that is structural and institutional racism to place minority groups in those situations, and it becomes circular, as people always would say, well, because of high crime, poor housing, lack of opportunities, it's a race issue, and it clearly is. There's other issues involved. These things are very, very, very difficult to bring to the front, to track. But all this and more, I've only mentioned a small part, is basically what racism is. But what of its impact? Well, as mentioned, it can lead to forms of chronic stress, trauma, feelings of isolations, distrust, and directly impacting to mental health and well-being. So where can you see where I'm going with this? If racism is out in the community and is causing these forms of mental health, deterioration, well-being, distrust, and so forth, where do you feel minority groups will be heading if these things continue? And I'll give you the answer straight. It's going to be towards your mental health system. So this gives the first sort of clue, basically, as what this talk is about, in a sense. Racism, no doubt about it, is out in the community at high levels. It's causing mental health deterioration. Those who are prone to mental ill health, and talking about minority groups, not saying other groups cannot be prone to mental health. That isn't the case. I'm just saying the impact of racism on those communities. And where will they be heading if they have these mental health needs to your mental health services? So where do the mental health services come in? Well, just as a reminder, we've got several types. We've got the structural, and I'll go into the other bit in a second. But it will create forms of structural racism will create barriers, not only if minority groups wish to access mental health care, but accessing care, the results of mental health care, the feeling of mistrust when someone looks at that data of minority groups using those services will again become circular because of that mistrust and distrust. People will think twice about using those services, and thus will lead to low engagement with those support systems. With community level racism, it also reinforces stigma. People just do not want to talk about the impact racism has on their mental health because they know they might be in for worse if they step forward and trying to engage with services that are not really designed by minority patients or the families that try and support them. So the stigma around mental health, and some cultures, I'm not saying this is purely to blame on mental health. We do have some cultures out there that will not talk about mental health, and this may impact negatively on them. So it's working together in order to reduce the silencing. Hence, in some communities, there will be silence regarding mental health needs. So the role of mental health services, you can sort of guess what I'm leading to. If racism impacts the community in that way, if it impacts Black, Asian, ethnic, traveling communities, vulnerable groups, LGBTQ+, then the mental health services have a massive role to play. What is that role? Well, they must move beyond treatment. They must move beyond the medical model and take an active role in those communities in promoting anti-racism. Hence, we're sort of looking at well-being, not just existing on the inpatient wards or the community mental health team, the hospitals, and that's that. It must adapt and move beyond those circles. I'm not saying this is easy. This is very, very difficult, and I expect failures to come for many years. But the start of this, and this is what I think anyways, it does involve listening to lived experience. Those watching the video from mental health organizations, because I do share my blogs, my videos to mental health hospitals, and I will come to the reason why in a moment. But when I say involving listening to lived experience, if you're a professional, this is exactly what you're doing. You're listening to someone who uh, as lived experience in providing mental health support to a close relative, and continuing to provide forms of care to my brothers, to be honest. But I'm going beyond that. I'm talking about quite an important, and don't get me wrong, I'm not saying it's not important to all, of course it is, but something that's far impactful. It's talking about building partnerships with local organizations. I'll give a hint from the care's perspective is obviously going to be your local care center that definitely might hold minority mental health groups and tackling health inequalities head on. As you can see with that second picture, you don't think you can see that clearly, but it shows one of the groups that I do anyway. I facilitate the National Ethnic Mental Health Carers Forum. There are other roles. Services should now begin. I'm not saying they've never had done this, but there's been perhaps little sparks of focus regarding cultural humility and inclusivity in practice, but that's not enough. It's got to be measured. It's got to be co-promoted, co-designed, monitored, and continuing to be ensuring that every individual feels heard and safe and respected. This is basically community building, as it is of now. There may still be a fair bit of focus on mental well-being is only in the inpatient ward, or it's only when someone goes to see the health professional, as a doctor, psychiatrist, care coordinator. It's more than that. It's community building. It's going out in the community and saying, this is what we stand for. Would you like to be a part of this activism, to be honest? So it's mental health moving beyond those ivory towers, or moving beyond the corporate focus. I say it's very, very difficult to do. These are challenging, almost split decisions in where we're trying to engage with the community, or the mental health services should try and engage the community. And I'm not saying the community has all the answers. We're trying to learn from each other. Engagement, and that's the key word, engagement, and also co-production with community should not only focus on just crisis response, because all you're doing really, if it's crisis response, is you're trying to take a sticky tape to a jar that's got leaks of water pouring out of it. This isn't, I'm not saying this shouldn't be used. Obviously, there will be need to focus on crisis response, but we need to also look at prevention. And they're saying that's basically, from what I'm gathering, education. It's also more than that. Social resilience building, engagement communities that are struggling with mental health stigma, are struggling with the impact of racism, and promoting well-being, the importance of well-being. Very tricky, I think, in some sense. It takes many, many years to train for mental health. And now we're asking the realm of psychiatry, psychology to now share that knowledge and also learn from those communities as well. So you might be thinking to yourself, okay, look, it's all fine, Matthew, talking about these things, but what is the main initiative out there, especially under NHS England, which is our national health service in the UK? And we have a framework, we have a guide, if you could put that as I may, and it's called PCREF. No, it's an anagram. Do Google that. Basically, it's the Patient Care Race Equality Framework. Its main aim is obviously to design and ensure mental health services deliver equitable outcomes for racialized communities. And you can see different logos basically saying what mental health services are doing in their local communities. They're saying, this is what we stand for, this is what we're trying to do. Let's go into it more. What does it encourage? And I'm not going to really do it justice because I've got to try and keep this video short. What does it encourage? Is, as I said before, the co-production of services with Black and minority ethnic communities, not just Black and minority, everyone, but the focus is on minority communities. So it's built and continues to be built from those that use those services. Remember the issue that I've mentioned before, we have services, mental health services that weren't really fit or designed for those who may use, especially if they're centered in diverse populations, diverse communities. Thing is, the proof is in the pudding, really. You can't say that we're working towards something if we don't collect and act on that data. There might be data that's actually saying everything's fine, but then it may dip. So it might not go quite right. There might be an incident. There might be increased impacts on racism in the community. There might be well-being issues, high rates of stress, or even suicides. So we're looking for patterns, racial disparities that will show in data. There's also got to be accountability and transparency in leadership. Again, very, very tricky, very difficult. Not everyone wants to take the leadership and say, look, we have an issue, we have a problem. Unfortunately, when leadership may say that or admit to it, there's always a risk that the community can just turn on that leadership. And it might be due to be impatient, saying they want results now. But I think it takes a lot of bravery, a lot of respect. I have a lot of respect for those who own up and are there to show that there are issues. Because if you have that in the community, then you're almost halfway in tackling health inequalities. The last bit, implementing the patient care risk quality framework, actually helps services embed anti-racist principles. What I'm also talking about from this perspective is with this video, this blog, use it in a sense to help build that trust, where communities, unfortunately, for many generations, many years, have a distrust of the health service because of maybe racism hidden, unconscious bias hidden in those structures, in the deliverance of mental health services. So we want to make things health equally measurable for that lived reality. I won't be doing much of my videos justice if I don't put down what I usually often stand for. And there's also another reason I'm not really a patient, so I can't really speak on the patient's behalf. And I do hope in the future we do have minority patients making these very same things, given their thoughts on involving patients. But for my focus, I work heavily towards unpaid carers and families. Not to say patients shouldn't be included, they are, but I don't feel that qualified to promote on that aspect. Sometimes I will touch on it though, but for this sake, involving unpaid minority carers, remember, I facilitate a national care minority carers group, and I do feel unpaid carers from that background, I'll always say this play a vital, yet often unrecognized role in supporting those that are going through mental health. And I'm not sort of saying just because the patient may have the need and the chronic need for that, families and carers do, especially if they're impacted by racism and discrimination and are struggling with the mental health system, will have their own forms of mental health needs, their own form of well-being. They're also not just mental health need, they also may face from a different aspect, from a different experience, additional barriers, such as language differences, cultural stigma, discrimination, and financial hardship. And the big one is confidentiality, especially in regards to the Mental Health Act. Families, not just now, but perhaps in the future, especially for minority groups, will face added pressures. So I've sort of forgotten to add this, that we do have the triangle of care, which is, again, an accreditation from Carers Trust that looks to include and help promote and identify minority carers, not just minority carers, but unpaid mental health carers as a whole. And perhaps at some point, I will do a video on that, or blog on that, on the importance I feel of regarding triangle of care. I actually, as of now, chair the triangle of care community group. So there's been several excellent things I've noticed regarding the triangle of care. And sorry if you don't particularly know what I mean yet. I'll see if I can put something in the description for those who are interested in that. They're trying very hard to involve families and carers, and I'm talking about unpaid mental health carers in service design. It doesn't stop at triangle care. It should definitely also be included in the patient care risk equality framework. But if you have the triangle care included in that, then that strengthens it even more. And it helps educate and involve in delivery especially ensuring more cultural response and effective support for all, whether it's patient or carer. Last bit is recognizing, valuing, and supporting not just unpaid carers, but the community as a whole, as a key to the community engagement and achieving racial equity in mental health care. So let's continue on. I'm going to eventually sum this all up. In a sense, racism, we must know, and I will touch on this again in future. It does harm well-being. It does cause, mental health needs, especially with its structural and everyday racism. You can't really get away from it now in its form. It's very clever. There are agents out there pushing towards racism. This impacts the community as a whole, not just Black and minority groups. I mean, I'm not saying those are not the main targets. They are, but it affects communities as a whole as well. Services must help lead that change. If we have the community seeking mental health well-being because of racism, then mental health organizations have a duty to promote anti-racism. It's not just healing, well-being, healing, and medication. Got to be inclusion and trust at every level. PCREF, and there are other frameworks. I'm just picking out the major ones. So the Patient Care Race Equality Framework drives accountability. If you don't see this in your region or in your area, do ask about it. What is your mental health trust or your private mental health provider doing in regards to PCREF? And with that framework, it ensures equity and transparency and community partnerships. There are challenges for PCREF. I'm not saying it's going to solve things in one go. That's not possible. There are things that is expected of the community, and I'll come on to that at a later date. Speaking from lived experience on empowerment regarding minority unpaid carers, I do feel we have to recognize families and carers and involving minority carers. It strengthens culturally responsive and compassionate care. This includes other initiatives, as I said, triangle of care. If you have that in your region, in your area, do ask how organizations are using that, and if they don't have that, then certainly ask. Well, if you don't have that and have that there, what do you have in place? So this is to sum up basically what I'm trying to get at, and we'll revisit the subject. I don't know if I put it across as best as I could, but I felt I needed to do this just due to the current climate and my involvement of trying to make I'd say a difference really towards the community. Anyway, I'd like to say, thanks for taking the time to watch this video. Sorry it's overly long. If you want to share the video, please do share it. We'll write a supporting blog. But I do feel it's an important initiatives because I do feel in the end we don't want communities that are struggling with mental well-being while ignoring what the causes are. And there are other things that can cause well-being issues in the communities, not just racism. But we'll touch on those in a future date. Thank you for watching and take care of yourself. See you again soon.